Okay, so we're going to go ahead and get started then. So we want to welcome everyone to our second Grand Round seminar for this semester. And we want to extend a gracious welcome to Ms. Kimberly Woods, who is at Seniorlink Caregiver Support Program. And what Ms. Woods is going to speak to us today about is the program itself, and then how they work and what their collaborations are. And so without further ado, to give her as much time as she needs, I will turn it over to Ms. Woods, let her introduce herself, tell us a little bit about her journey to the program, and then let her continue with the program. So Ms. Woods, the floor is yours.
Thank you, Dr. Telfair. Good morning or afternoon at this point to everyone, and thank you for the opportunity to share information about Seniorlink Structured Family Caregiving Program. I myself have been in Georgia over 25 years now. I reside in the Augusta, Georgia area. I've been in social work for over 20 years. I graduated from Augusta State University in 2002 and started my social work career from there. So this program is a really new resource that will change the trajectory of service and caregiving here in Georgia. So I've worked with several different service providing organizations such as WellCare, the Ronald McDonald House, the Department of Behavioral Health and Developmental Disabilities, the Department of Family and Children's Services. And when I saw this program come to the state, I just had to be involved. So I am grateful for the opportunity to share this information with you. Our goal is that this resource can be shared amongst your community and beneficial to those who are caregiving for family members. So at this point, I will share my screen and start my presentation. Is everyone able to see my screen and hear me?
Yes, ma'am.
Okay, wonderful. So as previously stated, our name is Seniorlink. What we do is we support families who are caring for their loved ones at home. So the program that we support is Structured Family Caregiving. And over the years, we have learned that collaborating with other agencies is the best way that we're able to support the families in the states that we operate in. We currently operate in 17 states throughout the country. And in some states, we have a different form of service. So our name is Seniorlink, but in other states, you may see our a similar logo under Caregiver Homes. So in some states, we're doing business as Caregiver Homes. In other states, we're doing business as Seniorlink. That being said, our name is somewhat misleading because it leads you to believe that we only serve seniors, which is not true. We serve any adult 18 or over who is giving or receiving care from a family member in their home. So I love to start my presentation with this picture collage because I challenge individuals to look at these pictures and tell me who's the person receiving care, who's the person giving care, and which one of these individuals are Seniorlink staff members in the home doing a visit. In some of these pictures, it's hard to tell, and that is our goal. We want to integrate those families providing care into our family, and we want to be integrated into their family. Caregiving is a hard task, and so we are able to provide them support to where they are not overstressing and burning themselves out. And we have several years of experience in doing this. So this picture collage, as I stated, is a montage of several different pictures. Some of them are family members who are caring for each other or receiving care. Some of them have some of our Seniorlink staff members in the home. And we have been very successful in serving families. We're currently close to 8,500 families throughout the country. And as of this morning, we are serving 721 families here in the state of Georgia. So before I allow this video to play, I would like to introduce you to Richard and Gloria. They are one of the families that we serve in our northeastern states. And Richard's story is very common amongst caregivers. And he speaks about his experience with trying to work and provide care, trying to have home health and provide care to his mother. And then lastly, how Seniorlink came in and was able to support his endeavors. I introduce you to Richard and Gloria.
My mom had a couple strokes, pretty much paralyzed her right side. And from that point, they told me that she had the Alzheimer's, dementia. And that's where my journey started. And I said it's better if she is at home in her own environment. That way she's used to her environment and enjoy herself. I had the aid set up so I could at least try to work. That failed. So I said, okay, this is gonna be it for me. You know, make this completely full-time. It's my mom. It's only one mom you have in this world. You know, and I would not turn my back on her. If it wasn't for caregiver homes, my day would be rough. They help a whole lot. Caesar is my care manager. He's a wonderful guy. Any information he gets, he passes it on to me right away. You know, and that's what I like. You know, you work together as a team, you know, not as individuals. You know, and I tell him that all the time. I appreciate it a whole lot. Hey, he's doing it from his heart, and I love that. My mom, she loves her Caribbean food. I do a curry chicken or stew beef, pigeon peas and rice, or kidney beans. She eats, she's happy, and she's enjoying herself. I'm always playing, and she's always laughing, always have that smile. Yes, she may be down, but she's enjoying herself. Still going strong, and I thank the good Lord for that. My name is Richard, and I take care of my mom. This is from here.
So I really love that tagline at the end because that's what makes our service different. Most services are to support the person receiving care. Our service is to support the person providing the care. As I stated, we want to help families keep their loved ones at home. We find that they live longer and happier lives by doing so. We do have several years in history of supporting caregivers, and we were started by a caregiver. Our founder was, upon retiring, found out that his mature parents were in need of care, and he, in trying to provide care to them, recognized that getting access to service was not as easy as he thought it was going to be. And he wanted to change that for other families across the country. And that's how Seniorlink or Caregiver Homes came about. In that 20 years of supporting caregivers, we've recognized that technology is a big pivotal part of what we're able to do and how we can communicate with our families. So we have developed an app. It's called Vela, with a V as in Victor, and it is accessible free of charge in the Google and iPhone Play Store. All of our families who enroll in our service have access to that app, and in that app, they're able to communicate with their care coach. As Richard mentioned, he has a care coach, Caesar, who is over his care and coordinates his care for him. And so they communicate regularly, if not daily, at least on a monthly basis. Also in our app, our caregivers have the option to access different types of education to help them improve the caregiving and care receiving experience. And we've also grown in our understanding of technology, and therefore have started a private Facebook page called Caregiver Nations. And it's for any caregiver across the country who wants to connect with other caregivers in their local area, get advice, support, resources, et cetera. And it's grown to over 6,000 members. And so when you've in service and providing service, you want to figure out what you can improve on, what you do well, what your clients need that you're not offering, et cetera. And so we do have a satisfaction report that we do on an annual basis. And our most recent statistics report that families feel as though our service is helpful, that they are confident in our service. They feel as though our services made their lives better, and they are over 91% likely to recommend our service to other caregivers. And we are rapidly growing here in the state of Georgia. So that being said, we are contracted with the Department of Community Health to provide this service. Our role in the Structured Family Caregiving Program is to provide support to that caregiver, provide educational opportunities to that caregiver, and also coordinate with their CCSP and or source case manager to make sure that all of our I's are dotted, our T's are crossed, and that they continue to meet program criteria as set forth by the Department of Community Health. So when it comes to our Vela app, there are a lot of features that we found to be helpful during the pandemic. Our service did not come to Georgia in response to the pandemic. This service called Structured Family Caregiving actually became or was approved, I want to say July of 2019. And so we started hiring staff in August, and we signed up our first family for service, I believe, in September in 2019. And when the pandemic hit, we were still in the throes of learning about Georgia and how to best connect with the families that need our service. And so our Vela app was pivotal because our program requires communication and in-person visits. And our Vela app was able to do that without actually having to be present. With the pandemic, we weren't able to go into homes as we were previously, and our Vela app allowed us to have our contacts and appointments virtually. We're also able to share real-time information. So there's a chat feature in our app. So we know immediately when someone is admitted to the hospital, if they have a fall or incident. We know about new diagnoses or any updated medication changes. We get all of that information real time and are able to share that with the case management agencies as well, who don't have that same level of technology to be able to communicate with the families on a regular basis. So on our app is, like I said, that chat function. They're able to send pictures. We're able to schedule meetings on our calendar. There's a joint calendar. So the caregiver, the care recipient, Seniorlink staff, and the case management agency are all on that same calendar. So as meetings are scheduled or details have been changed, everyone receives the same information at the same time. And so, sharing care plans, documents, things like that were made successful and seamless during the pandemic. And that's why our service really kaboomed during that time frame. I believe the first year we signed up over 500 families, and it's been growing strong ever since then. So what exactly is structured family caregiving? It's really what they said. It's really the name. Georgia realized that families are caring for their loved ones at home instead of putting them in nursing homes or state-run care facilities. And during the pandemic, they were pulling people out of those nursing homes or state-run facilities. And so that the state of Georgia wants to put structure around that care that is being provided in these homes. And the way that they're doing that is by creating the Structured Family Caregiving Program. The criteria to enroll into service is that both the caregiver and the care recipient be adults 18 or older. They have to be related to each other, either by blood, marriage, or adoption, but they cannot be spouses. And the reason for this is financial responsibility. The state of Georgia looks at spouses in the exact same light as they look at parents of minor children. A parent of a minor child is financially responsible for them and is going to care for them, just like a husband or wife is financially responsible for the other and will be providing care to them. So we're not able to serve spouses. There is a program through the VA the VA has a caregiver support program that does allow spouses, and I believe it might even allow other relationships outside of family. So I usually make referrals to that program if there's a veteran that we're not able to serve. So, and sometimes the relationship we have to have a conversation about that, because I get calls all the time, for example, where a woman wanted to enroll into service because she was caring for her mother-in-law. And as I started to ask additional questions, I found out that the husband had passed away, which was why she was providing the care. In addition, they had gotten a divorce prior to him passing away. So this person she was caring for was not legally her mother-in-law. But I also learned during that conversation that the husband and the interested caregiver had a child, which now made that interested caregiver blood related to the person she was caring for. Not as in her mother-in-law, but through her son, she was blood related to that person. So we were able to enroll them into service. And they can also be adopted. So for example, if my husband and I adopt a child and I or my husband fall ill, that child can care for us or anyone else in our family, either my husband's family or my family, because they are related to my family and his family through adoption. And we just spoke about marriage, where if my mother or father or sister or brother falls ill, my husband can care for them and I can care for individuals in his family on this program. And they have to live in the same home, because the level of care that we support is nursing home level of care. And we find, as Richard had mentioned, that it's difficult to work a job effectively and provide this level of care. And so one is struggling for most people, and usually it's that job. So that being said, this program offers a financial stipend to those individuals who are caring for their loved ones at home. And so to get that stipend, they have to meet these criteria where they're both adults related to each other and living in the same home. In addition, at the bottom left-hand side of the screen, we also look at the level of care that they're providing per day. They have to be providing a minimum of 5 hours of care every day. That doesn't mean you have to be with the person you're caring for 24 hours a day, but we are looking at what is it that they need help with. Is it a physical concern of help, or do they just need supervision and support? And so transferring in and out of bed or into or out of a seated position, assistance with bathing and grooming. Is this individual able to, physically walk to their dresser drawer or their closet, pull out their clothing and dress themselves from head to toe? And when they dress, are they dressing appropriate for the weather? Those are things that we look at. Do they utilize walking equipment? Are they able to walk on their own? Are they able to prepare their own meals? And then what type of support do they require for toileting? So these are some of the top 4 or 5 things that we look at when we're trying to gauge the amount of care that's being provided per day. But there are additional things that we look at, like medication management, transportation assistance, who's handling their finances, and add all of that up together. Once we do find a caregiving family that is interested, the caregiver is required to pass a state and national background check. And the only thing we're looking for is felonies. If there's anything less than a felony, that won't be a concern. But if the caregiver does have a felony, we are not able to enroll them into service on our program. The next slide is a video about caregiving throughout the country and how important it is that we continue to develop additional programs to support these caregivers. So here in the state of Georgia, we're able to serve waiver-approved individuals. There is a Medicaid waiver. If you're familiar with Medicaid, you know there are over 500 types of Medicaid. There is a Medicaid waiver called the Elderly and Disabled Waiver Program, EDWP. And that is required for the individuals that we serve. And this is for people who are either elderly or disabled and have a nursing home level of care. And it is a form of Medicaid. So we are not able to determine Medicaid eligibility, but we do have friends at the AAA who help us to assess each family that is interested in our service. And they do gather all the information required to make that determination about whether or not they would be a good fit. If they are, we then have the AAA make a referral to DFACS. So we're able to serve people who are Medicaid eligible. That being said, if we meet a family that does not have Medicaid, but we feel that they could qualify for Medicaid, we'll start that process of helping them to do so. And we do not send families to the DFACS office. We go through the AAA, which alleviates some stress and tasks for the caregiver themselves. So if the AAA determines that they would be a good fit, they then contact DFACS. DFACS will then determine eligibility and get in contact with the family to say that you have or have not been approved. And that's when we come back into the conversation to talk with them about next steps. So I'll go on to the next. From there, once a family is eligible, we have several things that we do, including the background check. We do an initial home visit because we want to make sure that the family is telling the truth, that they live where they say they live, that they do live together, that the home is safe and secure for both the caregiver and the care recipient, that there aren't any home health equipment issues that need to be repaired or replaced, et cetera, et cetera, et cetera, that they know how to use our app. So we do have staff who go into these homes strategically placed throughout the state so that we can develop those relationships. Then they'll get a telephonic call from their care manager. As Richard mentioned, his is Caesar, who will monitor their daily check-ins to make sure that there haven't been any concerns and at least telephonically communicate with them once a month. So we're seeing them all the time. When they get onto service, we're doing that home visit, introducing ourselves. They have a daily check-in that's 5 questions. So it's literally 5 minutes that they have to spend doing that. But that's how we know if there's been a hospitalization, an emergency, a new diagnosis, or medication update. And then from there, they're communicating with us at least telephonically every 30 days. And we have follow-up initial home visits every 6 months. And that's the program in a nutshell. The families do receive a stipend. The stipend is a daily allotment of $59.45. And I will say this, it was recently increased as of January 2022. It used to be when the program started $54.25. And in January, it was updated to $59.45. And the program is going so well, and the state of Georgia is really in support of this program. I've been in social work 25 years. I have never seen them pay anybody. So that's one good thing. In addition, they gave them back pay from July through January, July of 2021 through January of 2022. Any person who worked a day got that $5 and some change increase for that whole time frame. And so that was a big Merry Christmas and Happy New Year. And I say all that to say that the state of Georgia sees value in this program and is putting additional dollars behind it because they recognize that these, as the video mentioned, these caregivers are providing a service and not getting any compensation for it. So that being said, they do get that stipend. And it's based on how many days they work provide care in a 15-day pay period. Their allotments go out on the 1st and the 15th of every month. And so if the individual that you're caring for is away from you, either in the hospital or you go on vacation or something like that, it's a money follows the person program. So any days that they are in the hospital or rehab or with another person, you don't get paid for. But if you provide care every day of every month, the stipend is $892 every 2 weeks. So it comes out to over $20,000 per year that the caregivers are making. And just to address some commonly asked questions, we do have caregivers who are receiving Social Security, disability, things like that. Anybody who is physically capable, mentally aware, and willing to provide care can provide care to another person. I get questions all the time. Well, I'm on disability. Is it okay? If you're providing the care for them, yes. But we also advise them to speak with disability in advance about how their income will be increased, because we want them to be able to receive disability and the stipend from structured family caregiving, and that is possible. Usually when they have that conversation with the Social Security Administration, the Social Security Administration will cap the benefit that they're giving to a certain amount so that we can give our full stipend and the person can receive both without losing either benefit. On this program, you can care for up to 2 family members. So I currently serve an individual in the Augusta area who is on disability herself. She is caring for her 24-year-old son who is unable to use his arms and legs. And she also cares for her grandmother. And so what the way that her stipend works is she gets $1,800 a month for her son and a separate $1,800 a month for her grandmother that she's caring for. The stipend allotments are given either direct deposited into the bank account of their choice, or we do have a reloadable debit card that they can choose to receive to get their stipend. What other questions do I get often? Oh, it is a tax-free stipend that we give them, but based on their tax situation, they may have to pay. We've had that experience over the last few years where when they receive this stipend, it is tax-free, but everybody has a different situation come tax time. So we have had some individuals who owed the government and they took their money. Trying to think what other questions we get asked most common. So when we're looking at eligibility to qualify, of course, it has to be Medicaid that the person is getting, because that's what pays the caregiver. Seniorlink doesn't pay the caregiver. We just verify that they qualify for the program. They are providing the care that's required. You know, we make sure everything is in place and report that back to the state, who then allots the stipend to the caregiver. And so a lot of the individuals that we serve are dually eligible for Medicaid and Medicare. If we have someone that is receiving disability, they still get their disability check. They still get to keep their Medicare. They get additional benefits. So a family that we're serving, the care recipient gets full service Medicaid. Well, what does that include? That includes dental, vision, regular office visits, pharmacy services, emergency room services, mental health, urgent care, and hospital inpatient and outpatient. The only thing that's not covered for these individuals is chiropractic service. They get free home health equipment. So as you saw, Ms. Gloria was in a hospital bed. Those items are free. Hospital beds, walkers, wheelchairs, shower chairs, bedside commodes. We can help get ramps put in to help the family get into or out of the home. And sometimes vehicle modifications can be provided. They also get free access to adult day services. So if there is a care recipient who wants to go to her local senior center, they can pick 2 days out of the week where the center will come and pick the individual up, take them to the center. They can participate in all the activities, which might be arts and crafts or some type of exercise. And they also get a meal before the center brings them home, free of charge. And lastly, the care recipient gets free I've fallen and I can't get up service. And the caregiver receives that stipend. So those are the benefits that individuals receive once they successfully enroll into our service. I think I've covered everything. So what makes us different is that we are the ones who support the caregivers. Not that we're not supporting the person receiving the care, but we want to make sure that caregiver is not stressed out, burned out, frustrated with access to care and things like that. So we help them in that way. We're able to provide them education. We're able to communicate with them virtually and we have dedicated care coaches and on the ground community engagement specialists who can go and reach out and touch our families if need be. I recently went to a young lady's home who was trying to enroll in service, and she was having trouble with her email. So I went to her home and helped her set up a new email. We provide that level of hands-on care to our families if it's necessary. And so I really feel like that's what makes us different. They're not working for us. They are not an employee of Seniorlink. They have no paid time off, no benefits, no workman's comp or anything. So we don't hire them. We work with them. We support them. We integrate them into our family and ask if, we can be integrated into theirs as well. So we don't treat them like an employee. We treat them like family. So that's the program in a nutshell. Please feel free to ask any questions that you have. I've also put my contact information here. If you know a family that is interested or you think could benefit from this program, I do have a referral form, or you can just give them my name and number. I get a lot of calls from families who just want to ask some questions to see if they qualify. But I would not send them to our website. Our website is great, but that being said, when they request a call back from the website, they don't get the benefit of having me to follow up with them and make sure that they understand the process, that there aren't any issues or questions, things like that. So any questions?
So thank you, Ms. Woods. For those that are on, do you have any questions about the program for Ms. Woods?
Very quiet group.
Yeah, for today. Let me start off though. So the geographic scope of your services. Could you say a little bit about sort of where you serve, what counties or cities in your region? Is it a regional or is it a city or a county scope that you serve? I'm
We
trying to
serve
think
the
of this.
entire state of Georgia.
Oh, okay.
So
All right.
all 159 counties. And we have staff placed in Augusta, Savannah, Macon, Columbus, and several in Atlanta. So we're always in the community doing health fairs, talking at church meetings, going to professional collaborative meetings. And then we have those staff who, go into the homes with the families.
Understood. Thank you. Dr. Ford, did you have a question that you were going to ask?
Yes, I was trying to, can you hear me okay?
Yes, sir.
Okay, I was trying to get my camera back on, but it's not cooperating very well. There we go, good. Thank you, Ms. Woods, for that presentation. It was very good. And all the folks are Medicaid eligible, I noticed, through the waiver program?
Yeah.
Yeah, we treated waiver patients when I was practicing. Is there anything available that you're aware of for folks that might be above the Medicaid level, but still yet struggling to cover some of these costs?
Well, that's one thing I didn't talk about. So the income limit for this program is set up to be in line with the Social Security disability allotment, which is $841. So anybody who makes $841 or less can enroll into our service, no problem. The next step is between $841 and $2523. So we can serve anyone who makes above $821, but below $2523. The issue is they have a cost share. So if, let's say, I come across a person who makes $861, that means that they have a $20 cost share. They have to pay that $20 back to Medicaid every month in order for, number one, their Medicaid to remain active, and number two, excuse me, guys. Excuse me, guys. I'm on a meeting. Thank you. Number two, the caregiver won't receive their stipend if they don't pay that cost share. So there is a possibility for people to be served if they make a little bit more money. It just depends on, whether or not they're willing to do that cost share. Now, my grandmother has a cost share. but she also lives in New York and does not have a living caregiver. So we're able to manipulate that cost share where we put all of her doctor's appointments in 1 month. So she only has to pay that cost share that 1 month that she's going to the doctor's office, which is about 3 or 4 times a year. The caregivers on this program cannot do that. So, you know, we talk with them about that. Initially coming in, I always ask, what is your income? Where is it coming from? And then have that cost share discussion with them. Now, if they have a high cost share, the only expense that will be able to reduce that cost share is medical expenses. And DFACS will accept receipts or proof of medical expenses for the previous 12 months. So, you know, if we have somebody who has a hospital bill or they're paying for adult undergarments or things like that, all of those things can be rolled up together to bring that cost share down, but it has to be done every year. Whenever DFACS reassesses your income, you have to provide more receipts to bring it down unless your income goes down, which we hope it doesn't. But so that's how we're able to get around that, you know, as much as possible. So we are able to serve some people, but at the end of the day, I'm not going to tell anybody to pay Medicaid back $600 a month, unless, you know, they have a dire need for coverage. So it just really depends on how high their income is, whether or not it would be worth it for them to move forward.
Okay, thank you, Ms. Woods. We do
Thank you.
have another question from Santino Ofo, I'm sorry. Could you go ahead and just ask your question, please? Santino.
Good afternoon, Ms. Woods. Thank you so much for the presentation. Actually, my question is, do you have any kind of link to assistive technologies for family caregivers? I know you talked about the link with the case management agencies. Do you have anything like that to support the caregivers within your program? Thank you.
Assistive technology, I'm not sure I understand what you mean by that.
I know you talked about the challenge of trying to balance work and caregiving. You know, so assistive technologies could actually help the caregivers actually more comfortable in actually offering care. So I was
To
thinking
give an
the program
example
had-
is what she's asking, Mr. Santino.
Okay,
Like, what is the example of assisted technology?
Okay, an example could be like helping you to remember things. Like if you have like let me think. Okay, like you have like a planner, like a digital planner, for example, that could help you plan your activities out. You know, something as simple as that. Though we have more complex assistive technology depending on your disability. So that's what I
Right.
mean.
Well, our Vela app does house several types of educational opportunities that caregivers can participate in, whether it be virtual classes, related articles to sleep deprivation, appropriate nutrition, how to appropriately lift someone. I know I've had to find a resource for a caregiver who wanted to learn more about appropriately lifting and transferring so she didn't hurt the person she was caring for or herself. And that was a 4-hour training that she took virtually and received a certificate. And our Vela app does allow for, what's the word I want to say? The calendar to send you reminders for things, and they can use the calendar however they like. Although we do have access to put our meetings and things on there, they're able to use that to help them remember things. So, you know, it really just depends on what their needs are. Our job is to, as we meet a family and talk with them, my job is to listen between the lines, because there's a lot of services and resources and things I know about that they don't even know about. And so when I ask them what their needs are, they start to talking, but I can say, oh, did you know that this program exists? Because they didn't even realize that they were having an issue with a certain concern, So I'm not sure I understood your question, but I hope I answered it correctly.
I think the app is an assistive technology, but people have different kind of disabilities. So I don't know, like the scope of the disabilities that the carers actually are dealing with. Because if you actually give us a background on that, I can actually say, okay.
Well, a large majority of the caregivers don't have The caregivers have to be physically and mentally capable of providing care. So the one that I guess would probably need the assistive technology might be the care recipient.
Yeah, the care
person-
recipient, sorry.
Right, the care recipient. And that being said, we don't necessarily provide assistive technology, but if they tell us that they have a concern for their loved one, our job is to find it for them.
Okay. Thank you both.
Absolutely. What other questions do we have? And I did put our referral form and our informational guide in the chat for you to review and share as you see fit.
Okay. Well, it's really helpful to know that your catchment area is actually the whole state. So that's wonderful.
Yes, yes, yes.
Okay.
And we're doing pretty good. We're up to 721 families thus far.
It's a lot. It's a big caseload. So anybody else? Okay. Anyway, so Ms. Woods, we truly appreciate this wonderful service, and we will be sharing this information with the rest of our community here, as well as the broader community. We really appreciate it. I think you're going to find there's a lot of people who are very appreciative of this, and they may contact you or your colleagues in some way, shape, or form, but we'll go from there. Overall, we just thank you for taking the time to talk to us.
Wonderful.
And we always, in public health, we're concerned about the whole person. So, and then all of their life. So we are truly appreciative of that. Anyway, so for everyone else, this is, we do have another seminar next week from Ms. Kimberly Park, and we'll follow up with that. So on behalf of the Jiann-Ping Sioux College of Public Health, Ms. Woods, we want to thank you for your time and effort. And if you yourself have any additional things that you want to bring up to us or questions you might have, we always are looking for opportunities to work together. And we have several people who are really good at that. So thank you for your time and your interest, and then we'll go from there. All right. So
yes, sir. Please keep us in mind for community outreach opportunities. We
absolutely.
would be glad to come down and share information in person. So thank you again, and I hope you guys enjoy the rest of your day.
Well, thank you. Yeah, we too look forward to someday to start having more in-person opportunities than just online. So we'll do that. All right. Take care of yourself and take care of everyone. Appreciate it. Okay. Goodbye.